Hello everyone, my name is Dr. Priyanka Saokar. I am owner of World Class Dental Clinic. My clinic is located on FC Road. Today I am making this video. Basically it is a continuation of the previous video which was related to gingivitis. So what is periodontitis or pyorrhea? Most of the time people get confused or patient get confused between the gingivitis and periodontitis. When they come to the clinic with the history of gum inflammation, there are certain signs and symptoms which can clearly indicate that the cases of periodontitis, and the inflammation is so severe that we need to give some antibiotic and some gum paints to cure the disease, or sometimes surgery might be recommended. So what are how it occurs? So gingivitis is the initial stage whenever there is inflammations of gum occurs. If patient is still neglecting the oral hygiene and oral health, that time the progression of gingivitis will be a periodontitis. So in periodontitis case, what happens in gingivitis, there is gum inflammation when the soft deposit, that is known as plaque, if patient is not able to remove it or not able to keep the oral hygiene properly, that time the soft deposit get converted into hard deposit. It is known as calculus, and that calculus causes gum inflammation. That is the first stage, that is known as gingivitis. Once patient neglect that too, when there is bleeding, when patient is brushing his or her teeth and still neglecting it, that time the progression will be periodontitis. Once that hard deposit, what exactly it happens, I will tell you step by step. That hard deposit, which is known as calculus, it harbors a bacteria, okay, and that bacteria, because of the anti-inflammatory body's response, the gum swells, okay. If you are still neglecting it, there will be more bacterial accumulation and it will start separating the gum tissue from the tooth surface. So there will be slight amount of pocket formation. Now there is extra space for bacteria to accumulate, for soft deposit to harden and get converted into calculus. So that calculus will be deposited inside the gum tissue, inside the pocket. Still, if the patient is neglecting, next stage is that calculus deposit will increase and it will start separating the gum tissue from the tooth surface, and it will causes loss of periodontal ligament also. So there is ligament which holds the tooth to the bone, okay. So it is known as PDL, periodontal ligament. So there is loss of that PDL also, and the severity of periodontitis increases. What are the signs and symptoms if the patient is having periodontitis? First thing, there is bleeding gums. Second thing, swollen gums. Third, there is foul smelling, halitosis. Fourth thing, if it is severe, the patient will feel that pus is coming out. There is a faulty taste inside the mouth all the time, no matter how many times he or she is brushing the teeth. Then there is slight amount of drifting of teeth. Patient can see the root surface also, means because there is gingival recession, condition where the gum tissue goes down. There is bone loss also, and in few cases there is formation of abscess. There is loss of tooth also. Teeth will start moving in severe cases. So these are all signs and symptoms. So in which cases it occur mostly? First thing, the bad oral hygiene. Such cases are more prone for periodontitis. Second thing, if somebody has type 2 diabetes, again there is loss of collagen structure in such patient, and there is chances of periodontitis. Third thing, in females, most of the time it is related to hormonal changes like pregnancy, menstruation, or during menopause. That thing can lead to periodontitis. Fourth, if patient is taking some medicines, that also lead to periodontitis. Fifth, if there is loss of salivation, if patient have condition of dry mouth or mouth breathing habit, that time also it can lead to periodontitis. So what are the treatments? First thing, patient has to maintain the oral hygiene properly. Second thing, deep cleaning and that is scaling and root planing is recommended. Scaling, where we remove the hard tissue deposit on the tooth surface, and root planing, we try to remove the hard tissue deposit from the root surface as well. That is known as scaling and root planing. Sometimes gingival curettage is recommended. Fourth thing, more severe cases where there is uncontrolled infection and patient is not able to do it properly, then most of the time we have to go for a flap surgeries, where tissue is separated, all teeth cleaning is done, and they for tighter contact tissue is stitched back to the tooth surface. That is known as flap surgery. Sometimes few cases where there are very deep pocket, we recommend flap surgery as well. So most of the patient ask the procedures are painful or not. Yes, for gingivitis the procedure whatever we perform usually are not that painful, but in case of periodontitis there is slight amount of pain, swelling, redness, as well as pus formation, and even patient has to take some oral antibiotic because there is too much of infection and bacteria accumulation. So a few days we ask to patient take some antibiotic. Every 3 months or 2 months we take follow up whether the pockets are reducing, whether the tissue is healing properly. Yes, there is a long term follow ups are recommended in case of periodontitis, that too severe periodontitis. Hope this video have helped you to analyze how to take care of cases where patient is, means if you are having too much of gum issues. Okay, so best thing is to maintain the oral hygiene. That also I've told in previous videos also. Twice you should brush your teeth, you need to floss your teeth, and after the lunch if it is possible try to use mouthwash, so that you are giving every 6 hourly antibacterial protection against the bacteria inside your mouth. Hope this video must have helped you. Do like my channel, subscribe it. Bye bye, take care.